My name's Dr. Joanna Chikwe. I'm Chief of Cardiac Surgery at Cedars-Sinai in Los Angeles, and I'm chair of the American Heart Association Scientific Sessions, which means I and my good colleague, Dr. Brahmajee Nallamothu, have been responsible for leading a group of about 180 people that have been working on putting together the biggest and most important meeting in the cardiovascular and brain health space. And it's a very special meeting because it crosses clinical and real cutting-edge translational and basic science. I think the topics that popped this year, judging by the excitement, the applause, where the rooms were packed, would be for people that are thinking about what might transform care. It's probably the hyperlipidemia studies and drugs such as Evolocumab that showed really significant reductions in challenging patient populations, really may transform practice. The gene editing therapy in much smaller studies looks to be a really promising therapy, and we are going to scrutinize the larger studies to see if there are any safety signals that raise concerns. I think that's going to be a real focus. Then I think leaping around, there were some very interesting trials in the atrial fibrillation space that were simply indicating that patients can probably come off dual antiplatelet therapy or anticoagulation a little bit more quickly, depending on whether they've had successful closure of their left atrial appendage or treatment of their atrial fibrillation. I think there was one, it's a slightly smaller study, but it may get the most interest because it touches on something that's most people enjoy, which is a trial that looked at whether stopping people drinking coffee could keep them free of atrial fibrillation or not. And I think the results surprised everyone. It seems like coffee is not really a problem if you're trying to treat atrial fibrillation. So coffee's okay.
I'm Heidi May, and I'm an epidemiologist at Intermountain Health. The study that I presented at the American Heart Association Scientific Sessions in New Orleans was called Target-D, and it was a randomized clinical trial that evaluated patients that had just had a heart attack to see if a personalized targeting dose of vitamin D supplementation to raise their blood levels of vitamin D to above 40 help reduce their risk of future cardiovascular events. So patients were randomized to two different groups. One group received vitamin D supplementation that was personalized to raise their vitamin D level to above 40, and then the other patient group was randomized to what we call usual care, where the study didn't contact them anymore and they just had their usual follow-up visits, however they wanted to do it and their clinician wanted to do it. Both groups, though, did receive vitamin D testing to determine what their level was in their blood. Those in the vitamin D arm received dosing based on those levels, and if they were below 40, they would come back in 3 months to see if they were above 40. Both groups had really low vitamin D when we started. They were around 26, 27 nanograms per milliliter, which is pretty low. And based on our algorithm, over half of our vitamin D arm population started on 5,000 international units. So we compared these two groups. Our average follow-up was about 4 years, and to see if there was a reduction in follow-up death, heart attack, stroke, heart failure hospitalization. We didn't find a significant reduction when you put all those outcomes together, but the thing that we found was that in that vitamin D arm, they had a 50% reduction in the risk of having another heart attack. I think what this study really showed is you can't just give patients fixed doses and think it's going to be okay. So it's important to test and then have a discussion between the physician and the patient on how they want to dose, whether they want to dose. The great thing about vitamin D, it's easily obtainable and it's pretty reasonably priced. There are some blood testing, but I think what the important message about this study is that it's personalized and it is important to test and then dose accordingly, that just giving a fixed dose might not be the answer.